Well, good afternoon, everybody. I'm Dr. Laszlo Medeiros, the Chief Medical Officer for Migrant Physicians Network, and I'm here again to answer some of the frequently asked questions that we have received from you after many of our webinars and discussions. So today is July 18th, 2023, and again, I'm presenting some of the questions and answers that are most current to the current date. These can again change in the future, as we know that COVID has been changing over the last several years. I am the Chief Medical Officer of Migrant Physicians Network. I'm also a hospitalist physician in South Central Pennsylvania. And so I'd like to report just briefly on some good news in that hospitals in Pennsylvania, like mine, have now had a real drop in COVID and specific COVID deaths. Over the last 3 years, we've been treating COVID patients since March of 2020. In late May, we reached 5,000 patients that have been treated in our hospital. We've had approximately 500 deaths, so 1 in 10 of the patients over the last 3 years who have had COVID serious enough to be hospitalized. But in the last year especially, those numbers of hospitalizations and deaths have declined dramatically. So we did have this situation now after COVID of having long COVID. And our first question today is a definition. Do we have an agreed upon definition of COVID? So that is a good question. This is an evolving answer. But in May of 2023, the Journal of the American Medical Association narrowed the definition of long COVID to its 12 most common symptoms, which are the following: post-exertional malaise, or significant fatigue after a physical or mental activity; brain fog, fatigue, dizziness, gastrointestinal symptoms, heart palpitations, issues with sexual desire, capacity, loss of smell or taste, thirst, chronic cough, chest pain, and sometimes abnormal movements. If a patient has any of these symptoms after an acute COVID infection, that patient may have a long COVID symptomatology, and it should be discussed with the patient's healthcare provider. You can access more questions on long COVID and other COVID concerns at our frequently asked questions, which is linked below. These symptoms will be potentially added to in the future, but for now, we have these 12 most common symptoms. Next question: is metformin a treatment for long COVID? Well, in June of 2023, a study came out that showed that metformin, a common diabetes medication, reduced the incidence of long COVID by 41%. This is quite impressive. While the study is compelling, this off-label use merits further research. Off-label medication use should always be discussed with your primary care physician. This is the physician who knows you best and can maybe tell us if you specifically would benefit from the results of this study. The study came out with certain specific criteria, and your family physician can look at this, your clinician can look to see if these results are generalizable to a larger population, and specifically for you, is this something helpful for you? This is why I believe that this should be best discussed with a primary care physician. You can read more about this study along with many other questions and answers in our frequently asked questions, which are linked below.